All right, if you're listening to this, it is likely because you wanted to sign up for our botanical medicine making class, but you either weren't able to attend or you live too far away to attend. So we've decided to go ahead and record this to share with you. Unfortunately, you obviously won't be able to make a tincture with us, but hopefully you can still utilize this information. And feel free to use our team of naturopathic doctors in case you do want an herbal remedy. We'll chat about that at the end of this. Anyways, welcome to Botanical Medicine Making. Today we are covering female hormones. So my name is Dr. Chelsea Birch. I am a naturopathic doctor and I'm also a registered herbalist, and I work at / own IVY Integrative. A quick little disclaimer before we get started. This information is generalized and intended for educational purposes only. We are not providing individualized medical advice or treatment during this presentation. Due to potential contraindications and variations in individual health conditions, it is essential to consult with your primary care physician or naturopathic doctor before implementing any strategies discussed in this presentation. All right, so let's get into it. Tonight's schedule, we're going to dive into some anatomy and physiology of the beautiful female body. Then we're going to go through some herbology basics. And we're going to learn some very specific herbs that I've chosen to dive into for female hormones. We'll go into medicine making and what that looks like. And then we'll end with a quick little snippet of what it looks like to work with IVY Integrative. So first, some anatomy and physiology. I think the best way that somebody has described the menstrual cycle to me was one of my first roommates when I was like 18 years old. She was like, Chels, do you realize what we as women go through every month? Every month, our bodies say, oh, we're going to make a baby. We're going to put cushions around the uterus that'll be cozy and warm. And then every month, what? No baby, and it tears down the walls of the uterus, and it's traumatic, and it's painful, and it's bloody. And that is what we go through every month as women. So I like that version of the menstrual cycle, but when it comes to actual anatomy and physiology, let's dive into that. So we have the uterus, and I'm not sure if you're watching this on a screen, if you can see my cursor, but we have the uterus right here, and on the lateral edges of the uterus, we have the ovaries. Generally, we have 2 ovaries. Some of us only have 1. And then connecting the ovary to the uterus is the fallopian tube. This is one thing when it comes to fertility. Ideally, you want both of these open. For some women, there's scarring or there's damage that's done to this. So some women only have 1 fallopian tube open. And even if they're ovulating every month, sometimes the egg only makes it every other month to the uterus. And then lining the uterus, you have a myometrium, which is actually a muscle. And then closer to the uterus than that, or inside, is called the endometrium. And this is where we see the pathology called endometriosis. Right below that is the cervix, which most of you have probably felt. And then you have the vagina or the vaginal canal, which is where we put our nice little tampon up. So when it comes to the actual cycle, we're going to explain the menstrual cycle, with a 28-day cycle. So the majority of women have between a 28 to a 32-day cycle. That being said, if you have a 26-day cycle or a 34-day cycle, that's still completely normal. What's not normal is if you are getting like a 45-day cycle or a 60-day cycle or a 14-day cycle. So any like dramatic outliers, something's probably going on. To kind of break down the cycle, there's 2 phases of the cycle. The first half of the cycle is called the follicular phase, and that's simply day 1 of your cycle, meaning the first day of like a true bleed. I'm not talking about spotting, I'm talking about like true bleed. You got your tampons or your pads or whatever you're using. That is day 1. And then ovulation is when your fallopian tube, your ovary actually releases the egg. So for most girls, that tends to be around day 14, especially if you have a 28-day cycle. So that first half of the cycle is called the follicular phase. That's when most women feel really, really good, hence the happy face. And then you got the second half of the cycle. So the second half of the cycle, from ovulation until you actually get a good bleed, is called the luteal phase. The reason why there is a sad face here is because this is when most women feel kind of crazy. This is where we see a lot of the PMS symptoms show up. So a lot of women think that PMS only happens, like 3 days before the cycle, maximum of a week before the cycle. But in all reality, a lot of women experience their PMS symptoms from ovulation all the way until they get a bleed. So PMS symptoms can include anything from breast tenderness, bloating, moodiness, which includes like sadness, irritability, anger, anxiousness, weepiness. Also, insomnia, fatigue, cravings, headaches, and a lack of concentration. So these are all of the common PMS symptoms. And if you're experiencing any of these and they're only for half the month and they come and they go cyclically every month, it's probably a PMS symptom. I just want to chat about ovulation real quick too. So ovulation for most women happens again around day 14, so like right in the smack dab middle of the cycle. That being said, I do have some women that ovulate on day like 4 of their cycle, and some women ovulate all the way on day like 26 of their cycle. So if you are working on fertility or you're just wanting to get to know your body better, you can always use something called an LH strip to start seeing where your luteinizing hormone is peaking, and that's going to give you an indication of when you're actually ovulating. Okay, so to break it down a little bit more, we're going to go through this chart. So what we just mentioned is that there's a follicular phase and then there's a luteal phase. So the first half of your cycle and the second half of your cycle. Kind of the reasons why they're called that is because of the two hormones that we see. So the first hormone is FSH and the second hormone is LH. And LH, again, is that hormone that we see that peaks just right before you ovulate. So if you're tracking your ovulation, you're looking for that LH hormone. This is just a cool picture of what the ovarian cycle looks like. So the egg actually coming out, and then if it matures or becomes an embryo or if it becomes a corpus albicans, which means that it was not fertilized and it kind of just becomes like this empty space. Our ovarian hormone level during the cycle. So during this first half of the cycle is where estrogen is very important. We see estrogen peak, and then as soon as you ovulate, estrogen ought to drop a bit and progesterone ought to rise. So for most of my girls, actually in the US in general, we have this overarching estrogen dominance pathology. So if your estrogen in relation to your progesterone on about day 21, so here, if your estrogen tends to be high compared to your progesterone, which is low, we see pathologies like endometriosis, PCOS, hypothyroidism, a lot of PMS. So basically, and especially if you've been on birth control for a while, we're normally going to see the picture of estrogen being too high compared to progesterone. So as an ND, we try and balance those out a bit. And there's some cool herbs to do that, which we'll chat about. And then here is just a nice little picture of what the uterus looks like. So day 1 is when you're bleeding. So obviously the uterus, the lining of the uterus is starting to diminish. And then as you go along in your cycle, especially with progesterone in the picture now, that uterine lining is going to be building up because it wants an egg to fertilize and make a baby. But if you don't have a baby, then it sheds and then you're on day 1 of your cycle. That is the long and short of the menstrual cycle. All right, so now on to some herbs. So herbology basics. If you are going and harvesting your own herbs, time of year really does matter. So in general, if you're harvesting in the summer, you're gonna want the flower because all the energy is in the flower. If you're harvesting in the spring, you want those fresh green leaves. That's where all the energy is going to be and all the nutrients is going to be. And if you're harvesting in the fall or the winter, then you want to go for the roots because all the energy and all the nutrients is going back to the roots. So it kind of seems like common sense, but in case you've never taken an herbal class, that is the way you want to harvest your herbs. And that's dandelion, by the way, in case you didn't recognize that herb. So we call it a weed, but it's got some really cool medicinal properties. All right, When it comes to preparing herbs, there are like 1,001 ways to do it. I'm a huge fan of using the whole plant because all the components work synergistically versus, um, pharmaceuticals are amazing, but there's a lot of side effects, and we are seeing the same things with supplements. When you're taking like a constituent and you're making it much larger and you're kind of getting rid of the rest of the plant, it does work well, but there tends to be side effects. One example of these is berberine, which you may have heard of, is really good for blood sugars. It actually comes from the plant Oregon grape, from a few other plants too. I would prefer, as a naturopathic doctor, to just use Oregon grape, the whole plant, versus berberine, which is a constituent, because there's less side effects and because we get a more synergistic, holistic approach to your health. So anyways, enough about berberine. Let's talk about different herbal preparations. One very easy one to take is a capsule. So that's just a dried fine powder. And then there's a decoction, which is basically like making a tea, except you want to steep it in water for about 20 plus minutes. So we use decoctions for when we have things like roots or stems, or the things that are harder, more barky, that don't come out in a simple tea steep. You're going to do a decoction. And then you have an elixir, which is simply herbs that are made with unfiltered sugar and liquor. An emulsion is an oil and water base, normally topical, and then you can use herbs as food, which is really fun if you learn how to use flowers and leaves in salads or in sandwiches. A fomentation is simply a topical liquid infusion that you normally put on like wounds, or you can also put it on bruises. Glycerin is really good for kids. So today we're making a tincture, which is alcohol based, but glycerin is like a sweet solvent that kids tend to really like, adults too, but just doesn't take as much medicine out of the plant, which is why we're doing a tincture. An infusion is a tea, basically. So that's the difference between a decoction and an infusion. Infusion is where you'll use more of like the leaves and the flower petals. And then we have an ointment. So this is made with oil and beeswax. A lot of people use those again on like wounds or in their skincare regime. A poultice is really cool. So this is kind of an older thing. It's normally using a crude herb. So you think about plantain, something in the garden. What warriors used to do back in the day is they would chew it and then they would put it right on the battle wound. And that is basically what a poultice is. They leave it on overnight and it heals the wound overnight. We don't do that as much these days because we use more of like ointments or emulsions. And then we have tinctures. So that's what we're making today. And those are alcohol extractions. And then there's vinegars, which is similar to a tincture, but it's using vinegar as a base to pull out the medicine. And then also wine, similar concept. You pour some wine over the herbs and it extracts the medicinal properties. So a bunch of different ways to prepare your herbs, but we are making a tincture today. So why are we making a tincture? Because there's so many pros and there's not that many cons. Some pros of a tincture is that tinctures can be made using either fresh or dried herbs. They're most commonly made with vodka, which is gluten-free, and they're more potent than most herbal preparations, which is honestly the big reason why I use them in the clinic. They also extract more constituents than most herbal preparations. So, for example, they extract mucilage, bitters, resins, like all of the medicinal aspects of plants. In general, they have a much longer shelf life than most herbal preparations. They're easily absorbed, and as far as my patients go, it has a higher compliance rate for prescriptions than using like decoctions where they have to take time to prepare their medicine. The only cons that we have to tinctures is generally they don't taste great. And then obviously because they're made with alcohol, they're a poor choice for people who can't have alcohol. So children, alcoholics, and anybody with a religious preference to abstain from alcohol. So long story short, this is why our naturopathic doctors and doctor of acupuncture prescribe individually formulated tinctures for their patients. How do we make a tincture? If you want to start from the very beginning, you basically coarsely grind or powder your herb, and then you want to place your herb in a glass jar, and then you're going to cover it with alcohol, ideally about 60% alcohol, and ensure that the herbs are completely covered, and then you're going to seal it tightly. So if you don't completely cover it, then you are at risk of having mold in your tincture, and then obviously you don't want to use it. Once you make the tincture, you want to label it with the date that you made it, the name of the herbs, and the solvent that you used. And then you just want to give the jar a little agitation or a shake 1 to 2 times daily for at least 14 days. Strain it and then store it in an airtight, dark glass in a moderately cool place. Simple, but not really. So that is why we're making it very simple for you today. We're just going to have you pick out 3 different herbs, and then we'll put them all into one bottle, and then you can take your medicine home today. All right, so how do we formulate a tincture? So today, if you are at the actual presentation, you'll be formulating a 30 milliliter tincture. If you're doing this at home, you can get these herbs individually and combine them like we're going to be doing at the workshop. So to make a 30 ml tincture, we want 15 milliliters of that to be the driving herb. So today we're going to cover Vitex, Agnus castus, and Angelica sinensis as our 2 driving herbs, the big game players. And then you want 10 milliliters of a supportive herb. So these are just herbs that they're not the main driver, but they're key co-players in your tincture. So we're going to cover Berberis aquifolium and Rhodiola rosea. And lastly, because tinctures notoriously taste terrible, we do want to add 5 milliliters of a flavoring herb. So the ones we're using today are rose and ginger. And ideally, you also want those flavoring herbs to have some medicinal properties that add to the medicine in your total tincture. Let's get started. So one of the 2 driving herbs is called Vitex agnus castus. Its generic name is chase treeberry. So the part used is fruit, and in general, Vitex is used to treat that progesterone deficiency, estrogen dominance that we chatted about. So that includes PMS, fibroids, hyperprolactinemia, irregular or absent menses, heavy menses, insufficient lactation, infertility, PCOS, and hormonal acne. If this rings a bell for you, and it rings a bell for most of my women, Vitex is probably a great herb for you. The dosage, we want to limit it to about 3 to 10 milliliters daily, which is hard to overdose Vitex in general. But there's a toxicity with it. So if you are taking it in high doses, which is like a ridiculous amount, it can actually inhibit all aspects of your anterior pituitary function, which results in a decreased pituitary, adrenal, and uterine function. But don't worry, it's very hard to do that, and we are not making that type of tincture today. All right. And then we're going to taste it all together. So if you are at the workshop, we're going to go around and we're going to taste it. If you're not at the workshop, then we're just going to skip to the next slide. So our next driving herb is called Angelica sinensis, or Donquay. So we use the root of Angelica, and this herb is specifically used to treat those painful periods related to clots, fibroids, and endometriosis. It's also used in PMS and menopausal symptoms and infertility, but really, if you are struggling with pain, you're going to want Angelica in your tincture. The max for this is 35 milliliters a week. It's contraindicated in pregnancy because it does stimulate the uterus, so we don't want to cause a miscarriage. It's also contraindicated in diarrhea, bleeding conditions, and extremely heavy periods because, again, it causes a little bit of stimulation and blood circulation to the uterus. All right, on to our supportive herbs. So Berberis aquifolium, also known as Oregon grape, is by far one of my most utilized herbs in the clinic, and that's because it's just good for everything. We use the bark of the root or the stem. This is actually a common herb in North Carolina, and you'll know it by pulling out the stem. So the stem, if you give it a little cut, is like a bright, bright yellow, and that's the part that you would use for medicine. So medicinally, I like to use this for female hormones because it helps to restore liver function. So, for my girls who have been on birth control for years and years, or any other pharmaceutical for a long time, or have gone through some fun heavy drinking or had a poor diet, this herb is really good for your liver. I also love it because it helps to regulate blood sugars, and it's beautiful for daily bloating and skin conditions like psoriasis and eczema. So if any of those ring a bell for you, I would highly suggest that you put this one in your tincture. This one again is really hard to overdose, 1 to 2 milliliters 3 times a day. If you are using it for blood sugars, then I like for you to take it before your meals just to help stabilize those blood sugars even more. The only contraindication is pregnancy. All right, our other supportive herb is called Rhodiola rosea, or also known as golden root. I'm obsessed with this herb because it is the happy herb. So it's kind of our SSRI in the herbal realm. We use the root, and it's used to improve mood. I've also seen it work magic for my patients who have OCD tendencies, and it's used to prevent headaches throughout the menstrual cycle. So if one of your main PMS symptoms is headaches, then you're going to want to put rhodiola in your tincture. It's also called an adaptogen, which simply means that it helps you to deal with stress. It doesn't take the stress away. It's not an anxiolytic, meaning it's not an anxiety breaker. It just helps you adapt a little bit better. So dosage for this is 1 to 5 milliliters a day. And just an FYI, a low dose of rhodiola is stimulating and a higher dose is more sedating. So for the tincture that we're making today, if you're doing 10 mils of this, then you're going to want to dose yourself in the morning because it might be a little bit stimulating. You can always try and take it at night, but if you notice that you're getting insomnia or having trouble sleeping, then you likely have a lower dose. All right, the only contraindications for rhodiola are bipolar disorder. And then if you are taking an SSRI or any antidepressants, there's a high caution warned with this because you don't want to cause something called serotonin syndrome. So if you are here and you're making a tincture and you are on an SSRI, please do not put rhodiola in your tincture. All right, and then it comes to flavoring. I love using rose for my women. So obviously we're using the flower, and for medicinal uses, the taste is uplifting and it's feminine. So I like to use this for my women who have menstrual pain, which is spelled wrong, constipation, depression, grief, nervous stress, and just overall tension. For my girls who feel like they're ugly or dirty or anything during their monthly cycle or going through a breakup or something, I love to put rose in there because it's that like feminine power that needs to come along with just not feeling strong about yourself. So 1 to 10 milliliters daily, and the only contraindication is if you know that you have an allergy to the rose family. And then ginger. Ginger is such a fun herb. This one is really nice for flavoring up your tincture if you like ginger. We use the rhizome, which is basically the roots, and medicinally it tastes energizing and warm. So I like to use ginger for my patients who have abdominal or pelvic cramping, or who struggle with gas and nausea or bloating, really anything that's uncomfortable in like the lower abdomen. Ginger is really beautiful for. It also increases circulation and draws medicine to the pelvis. So I put this in most of my tinctures for my endometriosis patients because it just really helps to draw the medicine into the pelvis. For dosage, you want to keep this to about 1 to 3 mils a day, 3 times a day. So ginger, I'm warning you, is very strong, especially the ginger we have in house. So a little bit goes a very long ways. It's contraindicated in people with sensitive stomachs. So use caution if you have an ulcer, if you have GERD, gallstones, kidney disease, or a tendency to hemorrhage, then these are all contraindications, and just stick with rose. Okay, so time to make your tincture. If you're here in house, this is an example label of how we're going to make our tinctures. So put your name at the top and then 30 milliliter hormone regulating tincture. And then you can pick your herbs. So 15 milliliters of whichever driving herb you choose, 10 mils of your supportive herb, and 5 milliliters of your flavoring herb. I would like for everybody to put the same exact directions on how to take it, and that is 1 ml in 1 ounce of water every morning. We're just going to keep it simple. You cannot go overboard if this is how you're dosing the tinctures that we're making here. Date made is going to be the 31st of January, and it should expire 6 months from today. All right, so if you made a tincture and you want a refill, just save your formulation and then you can call or email us to get a refill. So here's our phone number, here's our email, and then if you want to just take a little screenshot of the QR code, that's how you can get a hold of us. But you know what's even better than getting a refill is making sure that you have the perfect formulation for yourself. So if you want to ever meet with one of our naturopathic doctors, we have over 100 herbs in our dispensary, and our naturopathic doctors can formulate one that's perfect for you in your case. You can start with a simple meet and greet with one of our NDs. They're free, they're online, they're 15 minutes. So if you're interested at all, go ahead and book a meet and greet. There is no harm, no foul in it. And a little bit about Ivy. So our mission is, Ivy grows over time, and our practitioners are deeply invested in helping you grow too. We believe that our knowledge brings growth and ought to be an integral part of your therapy. So our goal is basically to teach you how to fish. We want to teach you about your body so you can leave empowered, and that you know all about your ailments, and you know all about how to help you get back to baseline. We have a bajillion services. Here's most of our services, but we're always adding services, which is really, really fun. And most of our patients are like, I want to do all the services. How do I do that? Well, you can do a la carte, which is just working one-on-one with one practitioner. But if you're wanting to see a lot of practitioners, then we definitely recommend a package. So this allows you to bypass all of our intakes. And then you can, if you buy a 10-session package, you can use 3 for acupuncture, 3 for naturopathic doctors, and then maybe 4 for massage therapy. You can utilize them however you want. Packages is our biggest seller because they just make a lot of sense. And you get an entire year to use them. So 10, 20, or 40 sessions, use them however you want, or you can book with an ND and they'll help guide you to what's best for you and who they think you should see. And then we have a membership. So I love the memberships for our patients who are like, I'm all better and I want to maintain my health. If you have a membership, then you get 1 service a month across the board. So you can have like massage in January, acupuncture in February, counseling the next month, naturopathic doctor the next month. It's really good for just maintaining your health. All right, so that's it. Quick and simple, because the rest of the workshop is going to be used to make tinctures if you are in-house with us. Otherwise, if you have questions and you are watching this recording, then feel free to email us at info@ivyintegrative.com. Thank you for attending, and hopefully we will see you at the next workshop.